Well, hello, it's Bruce Williams again, and it's Friday, so it must be time for another Gross Path Challenge. This one is Gross Path Challenge number 35, coming from the third gross test of the 2010 Descriptive Veterinary Pathology course held on the grounds of the AFIP in Silver Spring, Maryland. In the last 5 tests, we've seen wonderful images from all of these great colleagues who provided images to me over the years, either directly or through online collections, which allow me to put these quizzes together in retrospect. So let's go ahead and get prepared. Get your paper, your pencils, your pens, whatever you want to use. Give yourself 60 to 90 seconds per question, and let's begin. Slide number 1 is an absolutely beautiful picture from a cat. What I want you to do is give me the morphologic diagnosis and a cause. Okay, time's up. A couple things to clue you into the true morphology of this lesion, and the number one most important thing is this pleural exudate. It's thick. It's high protein. It's almost honey-like in its consistency. And then most of the tissue, including the mediastinal tissue, the pericardium, and the pleura, are covered with a mat of fibrin. This should make you think about the disease feline infectious peritonitis. The cause is a mutated feline coronavirus. All cats have feline coronavirus as sort of part of the normal flora of their intestine. But in some cats, a very small number of cats, within the individual, this virus mutates to acquire the ability to survive within macrophages. And once it does that, the cat can no longer fight this disease, and it will develop feline infectious peritonitis. The morphologic diagnosis for this is multifocal coalescing exudative and fibrinous pleuritis, pericarditis with vasculitis. Remember, vascular disease is the hallmark of feline infectious peritonitis. No two cases look alike. Some look like granulomatous inflammation, some lymphoplasmacytic, some of both, but one of the key factors for everything is the vasculitis. The inflammation of the vessels, the concentration of the inflammation on these vessels results in the outpouring of protein and fibrinogen-rich fluid from them, and we get this very thick, high-protein exudate within the abdomen, within the pleura, within various potential spaces of the body. Great picture of a florid case of feline infectious peritonitis. Ready to move on? Okay, slide number 2 is from a rabbit. Once again, let's have a morphologic diagnosis and a cause. Okay, time's up. I absolutely love this picture. Okay, I think pretty much everyone's going to recognize that this is a picture of the liver. And there is a pattern here. There's definitely a centrilobular pattern to it. Now, if you're looking at this for the first time, a couple things I want you to think about. There's a pattern. Let's just say there's a pattern. The question is what's the abnormal part? Is it the lighter yellow or the darker red? In most cases, necrosis of the liver is going to give it sort of a blanched whitish color. The other big clue here is look at how flat this liver is. It is pushed up by this organ, whatever it is, underneath it. I think it might be the colon here or the cecum, but it's just sort of laying it. It's like it's a dish rag liver. So if we put this together, this sort of blanched appearance in every single lobule and the flat dish rag appearance, this is classic for massive necrosis of the liver in any species. When I talk about massive, it's a very specific term for necrosis in the liver. It means that that is necrosis that affects all parts of the lobule, the centrilobular areas, the midzonal, and the periportal areas. The entire lobule is wiped out. So what we're looking here, this pattern is every time we see this sort of lighter area, This is necrotic hepatocytes. And then these areas around it are areas where the portal areas are, and possibly some hemorrhage at the border of these areas of necrosis. When you think about massive necrosis in the liver of a rabbit, first thing you want to think about is the cause of this. And this is rabbit calicivirus, also known as rabbit hepatitis virus, a disease that causes massive, widespread mortality in wild and domestic rabbits. The morphologic diagnosis would be diffuse, massive hepatic necrosis. You'll also see areas of necrosis within the intestine. You will see lymphocytolysis throughout the body. And if the animal hangs on just a little bit longer, you might see hemorrhages in a number of organs and thrombosis, including the lungs, which often have areas of hemorrhage and thrombosis, because when you wipe out the liver is where much of the anticoagulant proteins are made. So you get hemorrhage, you get platelet overutilization, and ultimately DIC. Okay, that's probably more than what you wanted to know on rabbit calicivirus. So let's move on. Slide number 3 is tissue from a ferret. Can you give me a morphologic diagnosis? Okay, time's up. You have to sort of look at this one pretty carefully. We're looking at the pancreas right here. There is a reddish nodule in the pancreas. And this is what a pancreatic insulinoma looks like in a ferret, also in a cat, or in a dog. Remember that an insulinoma or islet cell tumor is an endocrine neoplasm, and as neoplasms tend to recapitulate the tissues they come from, this one is red because endocrine tissue has a lot of blood vessels in it, because they secrete hormones that have to go around to the rest of the body. So when you have a tumor of endocrine tissue, it often is heavily invested with vasculature. Luckily for us, these pop up in the pancreas, which is normally whitish. These particular animals will show signs that are consistent with sporadic to eventually prolonged insulin release and hypoglycemia. They may vocalize, they may have seizures, they may go into a coma. Unlike the dog and cat, where this has a poor prognosis, in ferrets it has a pretty good prognosis. It does not tend to metastasize widely. Usually in the dog and cat, you see it metastasize widely before the animal shows clinical signs. In ferrets, they tend to stay restricted to the pancreas. Now, when you take that out, you have about a 40% chance of others developing over time. But they don't metastasize and kill the animal that way. As I always say, a ferret is not a dog, nor is it a cat. Okay, slide number 4. Okay, slide number 4 is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up. This is a very common congenital abnormality, especially in people, and it's thought that 1 out of every 1,000 people have this congenital fusion of the kidneys, which is known as a horseshoe kidney. Usually doesn't cause any significant problems, and Mel Gibson is somebody who has a horseshoe kidney, believe it or not, and it's seen in a number of animal species. Very rarely does it cause any problem. The problems often arise with a fusion of the ureter as well. But in most cases, it's a silent congenital abnormality which causes no problems and is an aha at autopsy. Slide number 5, as you can see, is tissue from a goldfish. How about a morphologic diagnosis on this one? Okay, time's up for this fantastic picture. And you may or may not have a lot of diseases of goldfish at the ready, but I can tell you that this particular fish probably floated near the top of the surface or at the top of the surface, and then finally one day was floating upside down at the top of the tank, like dead fish do. And this big cystic mass, which you see in the abdomen, is the kidney. This is a polycystic kidney, and goldfish are well known for developing polycystic kidneys. The genetics haven't been worked out in them, but it is a disease of goldfish, one that you need to know about. Polycystic kidney. Okay, slide number 6, going back to the horse. Can you give me a morphologic diagnosis for this particular lesion? Time's up. Well, if you have been doing these tests on a regular basis, this one comes up fairly regularly. And it's one of those that it's very difficult to tell the organ when you look at it, but really nothing else looks like this in the horse. And I always tell my residents, if you can't tell what it is, and it's cystic and hemorrhagic, and it's a horse until proven otherwise, it's an ovarian granulosa cell tumor. These particular neoplasms secrete a number of hormones, including inhibin, and that upsets the normal balance of testosterone and estrogen. These animals may show nymphomania or other signs of masculine behavior because of the abnormalities in testosterone secretion. Ovarian granulosa cell tumor. You know, they don't look as hemorrhagic and cystic in other species. They're not uncommon tumors. Fairly common. They're the number one tumor of gerbils, and they're not uncommonly seen in a wide range of species. We talk about the rosettes that they often form, and these are called Karl-Exner rosettes. But if you don't see the rosettes, don't worry about it, because a lot of tumors don't have them. They may be solid, and you just don't see the Karl-Exner. So don't make Karl-Exner bodies a must for the diagnosis of granular cell tumors. You will be disappointed more often than not. Slide number 7 is tissue from a macaque. And I want you to give me 3 possible causes. Okay, time's up. That was from a macaque, and it's sort of difficult to tell where you are. It's very red, looks somewhat necrotic, and we're going to play the gamesmanship bit a little here, because you know, when I look at something like this, one of the first things that pops into my head is, could this be a uterus? Could this be cystic endometrial hyperplasia? But then, how would I come up with 3 causes? When someone asks you for that many things on a test, I think that they're probably going for a toxic principle or perhaps an infectious disease. In this particular case, we're looking for an infectious disease. This is necrotic or necrotizing colitis. Whenever I see a macaque, if I see hemorrhage and necrosis in the colon or the intestine, the first thing I'm going to think about is going to be Shigella. Shigella, Shigella, Shigella. And there are lots of Shigellas. And you could fill up 3 just with Shigella. How about Shigella flexneri, Shigella dysenteriae, Shigella sonii, or Shigella boydii, all of which cause a necrohemorrhagic enteritis or colitis, or even typhlitis in a macaque. Other things that I think you can't absolutely rule out would be Campylobacter. So Campylobacter jejuni or Campylobacter coli are good possibilities. And I might even, probably not, but I might even take Brachyspira, Pilosa Usually that, when it causes colitis, you don't see that much necrosis and hemorrhage. So, but if you can give me 1 of the Campylobacters and 2 of the Shigellas or 3 of the Shigellas, you've answered this question. So remember, that's for multiple causes. Think infectious or perhaps some sort of toxin. Slide number 8, we're going to stick with the lab animals. This is tissue from a mouse. I would like for you to give me 2 morphologic diagnoses. Okay, time's up. We have 2 very large organs here. We have this one and we have these. Now, if you thought that, here's a little urinary bladder here. If you thought that this was a male mouse, I'm sorry, you're not going to get this question correct. This is not male. Okay, whereas rodents have large seminal vesicles, they never get this big. So, we're looking at a very large and fluid-filled uterus. This is mucometra, and that's one of our morphologic diagnoses. Then the question is, what is this? And this is the vaginal vault. The vulva is down here. This is the vaginal vault. It is extremely distended with fluid because this animal has an imperforate hymen. This is seen in a number of strains of mice, including C57 blacks. This is a black mouse. That all fits together very nicely because there is an imperforate hymen. There is no discharge of fluid from the uterus. The uterus fills, it fills and distends the vagina, and this is the typical appearance. If you've never seen it, you'll remember it next time. Imperforate hymen and mucometra in a C57 black mouse. We only have 2 left. I think everybody's going to do well on this one. This is tissue from a calf. Name the disease. Okay, time's up. Well, this animal was probably born very recently. There's a bit of keratin, maybe a little bit of meconium staining on the hooves. And there's something here that should not be visible in a normal calf, and that is the heart. The disease name is ectopia cordis. There's nothing wrong with the heart. Heart is perfectly normal, probably beating when the animal was delivered. But it is outside of the chest. This is a thoraco-abdominal ectopia cordis, and the problem is with the sternum and the musculature overlying the sternum. Ectopia cordis, the heart can come out through the sternum. In this area, it can be sitting up in the neck in what's known as a cervical form of ectopia cordis, and it is not an uncommon congenital defect. Fixable in people, but nobody really goes to the effort to fix it in calves, I don't think. Ectopia cordis. Okay, we have one more slide for this week. It's a goodie. It's a beautiful picture, which I think was taken by Dr. Paul Stromberg or Dr. Steve Weisbrod up at the Ohio State University. And because it's such a great picture, it's tissue from a foal. I'm going to end this one on a high note. I want you to give me the pathogenesis of this lesion. It's tissue from a foal, slide number 10, a gorgeous image, and I'll give you 90 seconds. Come up with a good pathogenesis. Okay, time's up. Remember that a good pathogenesis has 4 or 5 key concepts. At one end is the diagnosis of the lesion. That's at the hind end of your pathogenesis. At the beginning is the inciting cause. So, the inciting cause here, well, let's start at the hind end, because I think that's one good way to start building your pathogenesis. What is this lesion? We're looking at the growth plate of a foal, then the metaphysis. And there is a large area of infarction, and then surrounding that is hemorrhage. We always have hemorrhage at the edge of an infarct because there's no blood supply here. So you have hemorrhage. This is where the blood vessels end up, and everything trying to clean this up, the neutrophils, all the hemorrhage, all that's always outlining it. You can see where the bone around has been dissolved by an inflammatory reaction that's been sitting there for a while. Okay, probably neutrophils lysing the bone. Okay, this makes this dead piece of bone a sequestrum. When we start to get some granulation tissue and some sclerotic bone form here, that would be called a involucrum. Right now we don't have that. We just have a bunch of lysed bone and a sequestrum. So my lesion is a suppurative fasciitis with infarction and sequestrum formation. Okay, so that's part of the pathogenesis. How did this start? Well, this started by the foal having an infected umbilicus. This is usually the result of a gram-negative organism, because they're always where baby foals are. Okay, there's poop there, they can lay in it, they can contaminate their umbilical cord. You have an ascending infection into the liver, okay, because that's where the umbilical veins, which are what generally becomes infected. The umbilical arteries will thrombose at birth. The umbilical vein may stay patent, and the infection will ascend into the ductus venosus, into the liver, and from there it jumps out into the rest of the body. And one of the places that these bacterial colonies will go to and get stuck are in the fenestrated vessels of the growth plate. Those little hairpin turns that go up into the growth plate, they turn back down, but at the top of that curve, those blood vessels are fenestrated. It's a great way for bacterial colonies to get stuck in the growth plate. They will cause thrombosis of all of those vessels and infarction of the underlying bone. I think we have enough to piece together our pathogenesis. My pathogenesis looks like this. Umbilical infection with gram-negative organisms, including E. coli, Actinobacillus E. coli, and Salmonella typhimurium. I think those are three good choices. Little arrow, joint ill or systemic sepsis, another little arrow. Septic emboli lodge in the fenestrated vessels of the growth plate, and one more arrow, suppurative fasciitis with infarction and sequestrum formation. It's a great concept, something that you absolutely need to know about foals. It'll happen in calves too, but oftentimes the timeline is much longer in calves, and you don't see the epiphysitis until 4 or 5 months later, or maybe you'll see abscesses in the vertebra, which can take years to manifest after a case of joint ill in a calf. But this is classic lesion for foals. Everybody needs to be familiar with. Okay, well, that's it. Brought it in under 25 minutes. That's about where we usually are. I hope you enjoyed this one. The wonderful images that I've been able to collect over the years through the benevolence of so many of my colleagues. Thank you all. And thank you for taking this quiz. We'll see you again next week with another Gross Path Challenge.